Now, I had braces when I was a little kid, and looking at how far things have come both for children and adults when it comes to orthodontics really amazes me. I was like, where was all this stuff when I was getting my braces?
Being invented.
I know.
You're so ancient.
You know, back.
Bye, Felicia. I'm just kidding. And, you know, and I have a 6-year-old, so
Yes.
if she has teeth like her father, she might need some braces. I love him, but, you know, he had bad teeth, so she might have gotten that from him. So I'm very interested in what is possibly available, you know, to us now. I mean, I hear there's Invisalign and all that stuff. So Dr. Richard Zemer is here to tell us all what we need to know and the latest inventions and everything that's going on. So first, I'd like to thank you for coming to the show.
Thanks for having me.
Can we explain a little bit about what is orthodontics and who is it for?
Sure. So an orthodontist is a dentist who's gone on to 2 to 3 years of additional university-based education to attain either a master's degree or a specialty certificate in orthodontics, okay? And so we're essentially studying nothing but orthodontics for 2 to 3 extra years. And so like I did my dental school at Indiana University, graduated there in 2003, and then went on to orthodontics training at St. Louis University for an additional 30 months and graduated there in 2005. Came back to Tucson, it was my hometown, and decided I'm going to go back and start a practice. And so I did that in 2006 and been going strong ever since. So.
Now, when you get into this practice, is it just about giving you that straight smile, or is there other things that you could also do if you're going to go to an orthodontist?
Yeah, so the main thing we do is straighten teeth. You know, absolutely, that's the main thing people see. But we also fix the bite as well if it needs fixing. And when I talk about the bite, I'm talking about how the upper and lower teeth fit together. There's certain problems that can develop as we get older if your teeth don't fit together correctly, such as periodontal problems or excessive tooth wear, or just overall other gum issues that can develop. So if we fix the bite, we minimize the chances that those problems can occur.
So what are some things that parents come into the office and everybody always asks, or what is something that they should know?
Well, the main thing to know about orthodontics is, well, first and foremost, you do not need a referral by your regular dentist to bring your kids in. Okay, that's one of the most common misconceptions, is that you have to have a referral. You don't. The main thing is bring in your kids at about 7 to 8 years of age, because that's when the adult teeth are coming into the mouth, and that's really when the bite's starting to establish itself. And so there's certain problems that if we diagnose early, we can correct them without having to do any really invasive procedures later on. So.
And I'm glad you said that about the 7 and 8, because maybe some parents are thinking, oh, we'll wait till you're older, and you know, then maybe we can see if we'll need them. But you're saying bring them in when it's developing, grab it early.
Exactly.
And that's why I think we have so many adults now coming in and doing braces or Invisalign or anything, because they waited so long through their life to do it. Do you see that there's like an uptick of adults coming in?
Oh yeah, absolutely. Probably 20 to 30% of my practice are adults, and whether they had braces when they were younger and they just didn't wear their retainers and their teeth have shifted, or it's their first time doing orthodontics because they didn't have them as a kid. Yes, we have a ton of adults, especially because it's also a lot more aesthetic these days. It's not just the old-fashioned big metal braces. We've got clear braces. We have Invisalign, which is another great method for straightening your teeth. So a lot more options these days.
Yeah, I had the big metal braces, and then we would put the different colored bands, like red, white, and blue for 4th of July.
Oh yeah.
Was not at all. But I love that now you have the ones where it's not so much like a mouthful of metal. And I'm assuming, is it easier, like pain-wise, for people that are getting it done? Because I know Invisalign is not as, people I know that have had it said you hardly even know.
Right, yeah, absolutely. It's a lot more comfortable. The wires we use these days are a lot more flexible. They're not as rigid as they used to be. They're called memory wires, and they're just a lot easier on the teeth. Now, you're still going to have a little bit of discomfort, but it's really not bad compared to what we used to have to do. And you know, orthodontics 20, 30 years ago, we used to have to band all the teeth. Now that we just glue the braces on or do Invisalign, so it's a much more friendlier process for everyone.
And what would you say, like the people that come in, do they think, you know, like the smile is going to, or are they thinking like, I'll just read it off. How will the great smile affect the rest of your life?
Great question. The key word that comes up is confidence, okay? And it's actually part of our slogan is Grinz, where confidence begins. When we get a child or an adult for their first exam, we take photographs of them, smile photographs. And it's amazing to me that they're very awkward trying to smile. They don't know how to smile. And so as we progress through treatment and their teeth straighten out more and more, they become much more confident to where by the end of treatment, you have a whole different person. Their personality is just so much more than what it was when they started. And study after study shows that whether you're a child or adult, you're going to be more successful in your personal or professional lives with confidence in your smile. So that's the most profound effect we see is the confidence.
You're giving them a whole new lease on life, I think. And
absolutely.
When I had my braces when I was younger, my family had to save and save and save for me to get those braces, but my mother always told me, this is going to affect the rest of your life. It's going to give you the confidence to go out there and do whatever you want to do. So they knew the importance, and you're telling us also that that's for anybody.
Yes, absolutely. It can improve anybody's life. So
I love that. I'm definitely a big testimony to that. So Grinz Orthodontics is offering free consultations to anyone interested in a beautiful smile. For more information, you can call 297-7575 or log on to grinzortho.com. Thank you, doctor, for joining us.
thank you so much for having me.